We're fortunate enough to have Scott Darius here today from Florida Voices for Health. He'll tell you a little bit about them, who they are, but he is going to give us sort of a global legislative update as we're entering nearing the beginning of the legislative session. Obviously, committees have been meeting in earnest for weeks, things of that nature. But today, what we hope to achieve at the RHP, this is more today probably about breadth rather than depth. I know all of us represent different entities, and we probably have our own legislative priorities that we will probably know a lot more about in specific in those silos. But today was meant to give sort of the broader rural health community and people who are involved with community health planning in general, kind of a little sneak preview of what the powers that be might have in store for us at the legislature. Scott's going to review some of that for us after he introduces himself and his organization, and then talk to you about a tool. Basically, it's a live Google Doc they have together that they're doing to do some of their own tracking of where things are in certain bills that he's going to mention today. And then we're going to welcome Scott back in May, unless for some reason the session goes extra time and we have to push that into June a little. But we're going to welcome Scott back into May and advertise this again so we can kind of give us a State of the Union recap of what happened in the legislative session. So what I asked today, we're not going to go through introductions for the sake of time. What I do ask today is we'll let Scott get through his presentation, and then we'll open it up for questions at the end. And then you can either submit those questions in the chat or just ask them directly live. So without further ado, and one more thing for those who've just joined us, I'm asking totally voluntarily that if you put your name and your agency or the community you represent in the chat box, that'll give me a chance to track today's participation. So now, without further ado, Scott, it's all yours.
Awesome. Thank you, Jeff. And really thank you to all of you guys for participating today and for giving me a chance to share some of this information. I'll say that I know a lot of you all have, firsthand experience and perspective on some of the stuff that we'll talk about, specifically the bills, if you have things that you're looking at and working on. So, I would love to learn more from folks who are deeper on any one of these bills and can provide additional context, things that they think are helpful, not just for the group, but also for me. Then please feel free to share at any point, like Jeff mentioned in the chat, but even at the end when we take on questions. Now, for those of you who, maybe are meeting us for the first time, like Jeff mentioned, I'm Scott Darius, and I'm the Executive Director at Florida Voices for Health. We're a statewide health advocacy organization, and our mission really is to help increase the access to care for low-income and middle-income Floridians. We do a lot of this work primarily through story collection, but a huge emphasis for us is working in coalition with partners across the state. And we've been very fortunate to work with, really great organizations, and I'll mention some of them as we go through the presentation today. Our focus as an organization, which I think will reflect itself in some of the bills that we highlight, are strengthening Florida Medicaid. So we'll talk a fair bit about that, improving access to oral health. And there are a couple of opportunities to do that during legislative session, and then protecting Florida's healthcare consumers. But as you all know, and as Jeff mentioned, so much of what happens with healthcare in Florida comes down to what happens in Tallahassee. Session officially starts next week, but so much has already happened since committee weeks began back in January. Today's meeting is meant to be kind of a preview for some of the healthcare bills that we'll see during session. First, we'll set the stage by sharing some context, some of the context we find ourselves in, especially in a post-COVID-19 world. And then we'll go into some of the structural changes that'll change how legislative session is set up this year in terms of public participation. But then we'll spend the bulk of our time together looking at these specific healthcare bills that have been filed to this point. There have been hundreds of bills filed already, and some even that I saw this morning as I was trying to put together notes. So that's to say that this presentation only takes us up to a certain point in time. There's obviously a lot more bills, even some that were filed before this, So it won't be everything that's out there, but at least gives us, I think, a sense of some of the bigger things that are moving and some of the things that aren't, but, you know, represent important priorities for all of us. And I'll say, finally, I was thrilled for this opportunity to engage with you all. I mentioned we work in coalition, and Florida Voices has only been around since 2017. And each year we try to take the next step in our outreach and, you know, our different capacities and how we do the work. And this year, I think we really wanted to put an emphasis on our rural health partnerships. We've had the pleasure of working with some of the folks on the line in the past, and I think, you know, planted the seeds at least of further engagement. But I hope that this meeting is a kickoff for just doing quality work together and lifting up the voices in rural Florida. But to start off with a little context, in the wake of COVID-19, right, tens of thousands of Floridians lost jobs, and I think we know that. But while that number is coming down from the pandemic peak, the unemployment rate is still double what it was before the pandemic, meaning that there's still a significant amount of hurt there. There's obviously an impact on our budget. I think we're projected to have a $2 billion shortfall next year. And while I think there's some anticipation of federal help, it's still clearly a concern. But in the face of the economic downturn, we know that Medicaid has again stepped up to cover hundreds of thousands of Floridians who I don't think were anticipated at the end of the last legislative session. I think nearly 700,000 Floridians have enrolled in Medicaid since the pandemic, and that has budget implications as well. And then finally, we know that Florida's hospitals are under even more strain as they continue to face uncompensated care costs, which have been there for a while. But I think what's significant in the wake of the pandemic is that they're losing revenue that comes from procedures like elective surgeries and, you know, other things that people can afford to put off. Now, I thought it might be helpful to share some kind of high-level background on healthcare in rural Florida, but I'll admit that it feels a little silly to tell you all this because you're the pros who see these conditions up close. Still, I think it's worth looking at the toll that COVID has taken in some of our rural counties. There's a report from Jacksonville University that found the highest death rates were in 9 of the rural counties. And that same report that found that the high death rates were directly related to poverty levels and just the overall inability to access healthcare. I think one revealing metric when it comes to the availability of healthcare, or the availability of, well, access, I should say, is the availability of primary care physicians. The Florida average is about 1 primary care physician for every 1,200 people, but in some rural counties, we see that, you know, as 1 to 8,000, 1 to 5,000, just much greater rates. And again, I assume that a lot of the stuff you're very familiar with. Additionally, from some of the great research of our partners at the Florida Policy Institute, we also know that the uninsured rate for low-income Floridians in rural areas is on average 13% higher than in some metro areas. So I think the uninsured rate overall in rural counties is about 37%, and in more urban areas, it's 24%. But unfortunately, in some counties like Columbia and Jackson, they have uninsured rates of 40 to 42%. Now, finally, I mentioned the stress that some hospitals are under, but I think that pain is especially felt in some of our rural communities. Of the 7 hospital closures in Florida since 2005, 3 of them closed in 2020. And you guys are probably familiar with this as well, but Shands Stark Regional Medical Center, Shands Lakeshore Regional Medical Center, and Shands Live Oak. I think 2 of them closed completely, and 1 might have converted to a smaller emergency only operation. But one of the things I was, really enlightened to learn last year working with Jeff and Joseph was just that how these hospitals also served as kind of a primary care location for so many people in these communities. And that, kind of blew me away to think that that one source of care had, suddenly been pulled away. So it's in these conditions that we arrived at the 2021 legislative session. But of course, in the same way that COVID has touched every part of our lives, it's also changed how legislative session is going to work this year. First, a quick look at the makeup of the legislature. After an election year, things have changed slightly. We have Republicans who, lead the Senate with 23 of the 40 seats, and they're led by Senate President Wilton Simpson. In the House, Republicans have a 78-42 majority and are led by House Speaker Chris Sprowls. And they've both since announced committee leadership and the committee assignments. Obviously, as that processes, the committee weeks have been happening. We're already, way down the road on that. The list here just highlights some of the committees and committee chairs who are likely to deal with the bulk of our healthcare bills this year. So, just to kind of give us a sense of who the players are. Now, another quick look at some of the important dates during session. It officially kicks off next week, Tuesday, on March 2nd, and it always lasts 60 days. Now, if you're thinking about last year, you might remember that session started in January, and this year it's in March. I think an even number of years when there's an election, legislative session always starts a little earlier, but we finally get a break this year, so session starts in March. Now, specific to COVID-related changes, each chamber developed its own rules for handling public participation. What's true for both chambers is that all committee meetings will be streamed live on the Florida channel, but that's been pretty standard for the last few years. Now, when it comes to public testimony in the Senate, they're using an off-site room at the Leon County Civic Center and having people participate by Zoom from there. Now, however, you can still get inside the committee meetings if you're an invited guest presenting information, or if you happen to have press credentials that you break out from time to time. Now in the House, not a whole lot of specifics to go into, or detailed specifics like we saw on the Senate side, but in the House, members of the public can actually still reserve seats in the live testimonies. You just have to use the online system to do that, and that system serves as both a registration for a seat and also the ability to appear, for public testimony. So if that's something, for folks who are based up in Tallahassee or have some interest in going there during session, there's still an opportunity to kind of interact personally. I'm not sure, however, how they're handling like one-on-one meetings with staff and legislators themselves, but I imagine that that'll be pretty restricted as well. But now where we'll spend most of our time just taking a look at some of the bills filed so far. Like I mentioned, again, this is meant to be kind of a high-level view at some of the bills, so we won't get terribly deep into them. I would also love any feedback that you all have on bills that you're watching or working on, or have some relationship with and want to provide a little additional context. But yeah, certainly it's not exhaustive, but worth keeping an eye on. But that long-winded intro was just so we could watch the I'm Just a Bill clip a couple times. I broke up I think this discussion, considering how many bills there were, I thought it might be helpful to break it up into the different categories. So we'll start with legislation related to Medicaid. It's hard to talk about Medicaid without mentioning how difficult it is for working families and for Floridians, just average Floridians, to qualify for coverage. Florida's Medicaid program is actually one of the most restrictive in the country. And while there are higher eligibility limits for mandatory populations like pregnant women and children, low-income adults, parents typically are left out. Well, single adults, but also parents who make above a certain threshold. Using a family of 3, for example, the most a parent can make in a year is about $7,000, and there's a little buffer there, but that comes out to about 31% of the federal poverty level. If you're a childless adult in Florida, there's absolutely no help for you, regardless of how little you make. And we see that as being kind of one of the major issues when it comes to our vulnerable Floridians. Now, Florida hasn't taken the opportunity to expand Medicaid, and the end result is this. Working adults without children making below $12,000 a year have no options for care, like we talked about. Parents who are making between 30% and 100% of the federal poverty level really have no other viable options for healthcare. And even some Floridians with disabilities are left out. Now, this all takes us to what I consider to be the biggest opportunity Florida has to improve access to healthcare in communities across the state, but especially in rural ones, and that's Medicaid expansion. While it's still a long shot, there have been 5 expansion bills filed this year. The moment we're in, I think, makes it urgent. And as you'll hear a little later on in the presentation, our grassroots coalition is looking to make that case. Now, as we think about the bills specifically, SJR, so the Senate Joint Resolution 276 filed by Senators Taddeo and Berman, they're a little different from the others in that it's a joint resolution, meaning that it wouldn't become law. If passed, it means that the question of Medicaid expansion would be put on the ballot in 2022. But to actually pass this legislative process, there's a higher threshold. It needs a 3/5 of majority vote in both chambers to then be put on the ballot in 2022. And then if passed there, it would become part of our Constitution. The other 4 bills are actually nearly identical pieces of legislation. I think there's just a comma in a different place. They both invariably expand Florida's Medicaid eligibility up to the allowable 133% of the federal poverty level based on the ACA. I'll also mention here quickly that we've seen a lot of public support for expansion over the last few weeks. Actually, 2 weeks ago, we released a poll and it got some media coverage, but it found that upwards of 70 to 75% of Floridians were supportive of Medicaid expansion. So although we don't see a whole lot of movement happening in the legislature, we know that it's something that has popular support and is gaining momentum. Now, the reason I say it has a potential to have such a great impact is that it's just in the sheer numbers of people who would benefit. Around 1 million Floridians would gain coverage. Before the pandemic, we saw that the estimated number was nearly 900,000 people, so somewhere south of that. And since the pandemic, we've seen estimates go as high as 1.4 million from, and I think that was from the Kaiser Family Foundation. So I think it's safe to say, especially as we kind of taper off a little bit, that over 1 million Floridians would likely benefit from expanded coverage of Medicaid. But so far during session, we've also seen efforts to expand certain benefits and parts of Florida's Medicaid program. One that we're really excited about is actually the extension of postpartum coverage. As it stands right now, women who are eligible for Medicaid because of pregnancies lose their coverage 60 days after the pregnancy ends. However, we all know, and some of us know better than others, I say we all know, I know academically, that the hard work of pregnancy and motherhood doesn't fade away after 2 months. And I don't think that's something we've really grappled with here in the US, because somehow we remain the only developed country with rising maternal mortality and morbidity. But House Bill 645 and Senate Bill 238 actually extend the postpartum eligibility period to 365 days, but also increases the eligibility limit for those, for pregnancy Medicaid, to those making up to 185% of the federal poverty level. Now, House Bill 201 and House Bill 1244 actually look to increase Medicaid eligibility limits for children. Now, I think part of the need for this bill stems from the fact that the number of uninsured children in Florida has gone up steadily over the last few years. According to the Georgetown Center for Children and Families, we've seen that number go up to 7.6% in 2019, and that's up from 6.6%. Now, I've seen that described as a statistically significant increase, And I'm interested to see how that was impacted even last year. Now, the bills actually increased eligibility to include children and families making up to 300% of the federal poverty level. But I think the bill does it in an interesting way in that that eligibility threshold would grow incrementally over the years at about 20% annually until we're at the 300% threshold. Now, these bills also provide guidelines to determine the family contribution amounts for those families that would be newly qualified. So there would, for some families at certain income levels, there would be the expectation that they contribute to, a small premium amount. And I think, that's a setup that currently exists. Now this bill, Senate Bill 852, Medicaid Modernization by Senator Broder, is on theme with some of the bills that we'll actually see a little bit later on. Telehealth is obviously the next big frontier, and in many ways, we're already kind of a significant way into our manifest destiny moment when it comes to telehealth. I was on the fence about mentioning manifest destiny, but we're on the other side of that now. The global pandemic, I think, was a big push we needed to kind of get there, right? To a place where telehealth is expanding, and now we're thinking about ways to regulate and to operate in that space. And there has been this flurry of legislation. This particular bill would allow Medicaid to cover telehealth services or telehealth devices and services that record and store video for later evaluation by physicians. Now, where a lot of the other telehealth bills we'll see are focused on services being provided in the moment, I think this bill is unique because it refers to asynchronous platforms, right? So the information will be stored and then would be later evaluated by physicians. Now, more and more health systems are taking this approach, and this bill just attempts to regulate and reimburse it. So next, another topic high on our list of organizational priorities is oral health. This bill is actually a bit of a segue from the last section. House Bill 1117 and Senate Bill 1552, filed by Representative Angie Nixon and Senator Jason Piso, respectively, looks to strengthen another part of Florida's current Medicaid benefit structure, and that's the adult dental benefit. Currently, adults enrolled in Florida Medicaid are only eligible to receive emergency dental services to alleviate pain and infection, but can also have procedures to ready the mouth for dentures, but not the dentures themselves. Beyond that, there really is no clarity about what non-emergency dental benefits are provided. Now, these bills specifically look to expand the minimum benefit to include services necessary to prevent disease and promote oral health, restore oral health structures, health and function, treatment of emergency conditions, routine diagnostic and preventative care, and basic services such as fillings and extractions, but also major dental services like root canals, crowns, and dentures. Now, from the research that we've done, also in great partnership with the Florida Policy Institute, it's fair to say that the bill will ultimately reduce Florida's budget spending on costly emergency department visits for dental conditions, and I think improve the health and economic security for thousands of Floridians. And actually, according to another one of our partners, Floridians for Dental Access, in 2019, Florida hospitals billed more than $630 million for preventable ER visits and hospital admissions that stem from preventable oral health issues. And Medicaid paid for nearly 40% of those visits. So this is a bill that we're really excited about and we hope moves forward. One of the things that we have going on this front, we've commissioned a report or a fiscal analysis from the American Dental Association's Health Policy Institute. So hopefully we'll have a much better sense of how this will play out on the budget if passed. I will say that it will likely echo the report they did in Virginia that found tens of millions of dollars in savings. But another promising initiative related to oral health is House Bill 961 and its companion Senate Bill 604. This bill attempts to solve Florida's issues with oral health access by addressing the provider side of the equation. Nearly 5 million Floridians, I think it's worth pointing out, are living in areas with limited access to care. And that's partly why we as a state pay hundreds of millions of dollars in preventable hospital costs. And I think a significant portion of the folks who live in these dental provider shortage areas are in rural parts of the state. But this bill would actually authorize dental therapists who are basically a mid-level provider in Florida. They would work under the supervision of a dentist and would have to complete years of schooling. And they've effectively been used in 12 other states, in large part because the industry itself, the field, has been marketed towards individuals who are also likely to return to serve in underserved communities. So I think what we've seen in a lot of states is that dental therapy, once it's authorized as a provider position, a lot of community colleges have taken on this curriculum, and that's, it's been a doorway to better jobs for a lot of folks in these communities. And these are typically the folks who return to provide care for, their friends, families, and neighbors. So helps us get to that problem of bringing providers to the places where they're needed. Now, next we'll move on to what feels like the most expensive part of the healthcare system, and that's prescription drugs. A popular proposal that we're seeing in legislatures across the country actually is capping the price of insulin across all health insurance plans. This was a bill that we saw last year, and it's returned this year on a bipartisan basis, which is nice. But House Bill 109 and Senate Bill 786 from Representative Bell and Senator Cruz caps the cost-sharing obligations for plan enrollees at $100 a month. Now, I mentioned Florida Voices for Health. We do a fair amount of story collection, so working with consumers one-on-one. And it's hard to describe the how prevalent the issue of affording insulin in particular was. As we met with different consumers, I was blown away by how many times it came up. And I think we learned that even this $100 price cap is still a burden in some sense for a lot of Floridians. The unfortunate truth is still that it helps a lot of folks, that it's actually an improvement on some of the out-of-pocket costs for low-income Floridians who we also know are dealing with these conditions, chronic conditions, at a much higher rate, and diabetes in particular. And I also wanted to quickly highlight some findings from a survey project that we partnered with the Altarum Institute back in 2019. That survey found that 54% of the nearly, I think it was 2,000 Floridians that we spoke to were either worried or very worried about affording prescription drug costs in the future. So both as a setup for this bill and I think all the other initiatives that we'll see on prescription drugs, just a reminder of how important it is for average Floridians. And like I mentioned, we've seen bills like this pass in other states, namely Colorado and Illinois. Now, the least understood part of how prescription drug prices are set is the role of pharmacy benefit managers. PBMs are a third-party company, or third-party companies, I should say, that serve as the intermediaries between drug companies and the insurance companies. The simplest way to put it, and I put this graphic up here because it at least helped me to start to wrap my mind around how PBMs work, but effectively they pool the money from the contracted pharmacies. They use, with that pooling, they now have purchasing power, and they use that to negotiate rates and rebates with pharmaceutical companies. And as it all plays out, the pharmacy makes their bit, insurance companies make their bit, and whatever's left over gets returned to PBMs. And as this system is kind of taken shape, we see more and more that, there's not a whole lot of transparency in kind of some of the contracts that are set up and what that means for, ultimately what consumers are paying for prescription drugs. House Bill 1155 and Senate Bill 390 tries to rein in and regulate PBMs who sit at the middle of this pricing process. The bills look to increase transparency on the agreements being made by requiring PBMs to submit certain contracts and contract amendments to the state. So just trying to bring a little more light to the agreement structures that are set up. Now you can imagine that this bill will likely face significant pushback from the industry and from PBMs themselves. And I'll say that ultimately, I think achieving any improvement to the cost of prescription drugs in Florida is going to take a concerted grassroots effort. So I plant that seed to say that I think there are a couple of organizations around the state working on prescription drug issues, but it'll really take a coming together to achieve, I think, meaningful change on this front. Next, we'll go into a category of increasing importance, especially after the year that we just had, and that's mental health and substance use disorders. Just to start off with a little context as before we consider a couple of the different mental health bills, Florida ranks 8th in biggest changes in mental health since April last year. We've seen reports of anxiety and depression going up almost 13% since the start of the pandemic. Now, it's a hard thing to comprehensively quantify, but you can see other alarming statistics, like a 65% increase in the calls to the Florida Behavioral Health Association. And relevant to some of the bills that we'll see, in 2019, more than a third of high school students reported experiencing feelings of sadness and hopelessness. And that number is way up from a decade before. But again, we're only beginning to understand the impact of 2020. Now, this bill attempts to strengthen mental health services provided in schools by shoring up the process of connecting students to community-based services. Currently, schools receive allocations to put different programs in place. This bill requires the schools partnering with outside organizations to connect students to services to execute an MOU spelling out the expectations that they have of those kind of third-party groups, including how and when records and information is shared with parents. I think that the expectation is that the increased accountability that comes with having, the expected outcomes and, the structure of the partnership written down will mean more effective and efficient programs to help students who are struggling. House Bill 405 and Senate Bill 828. Now, this bill is specifically related to Floridians with serious mental illness. It does a couple of things, but most importantly, it revises the requirements for when someone can be taken for involuntary examination and involuntary inpatient placement. It adds, so there are a couple of standards that it tries to more clearly define. The neglect or refuse to care for himself or herself standard includes but isn't limited to evidence that someone is unable to satisfy basic needs for nourishment, clothing, medical care, shelter, or safety in a manner that creates substantial probability of imminent death, serious physical debilitation, or disease. And then there's the real and present threat of substantial harm standard that includes but isn't limited to evidence of a substantial probability that the untreated person will A, lack, refuse, or not receive services for health and safety, which are actually available in the community, or B, suffer severe mental, emotional, or physical harm that will result in the loss of his or her ability to function in the community. Now, this bill is actually moving through the Senate. It was passed by the Children, Families, and Elder Affairs Committee as a committee bill, and passed unanimously 8-0. It now goes on to the Senate Judiciary Committee, but the House bill has not moved yet. Now this bill, House Bill 119 and Senate Bill 1188, is actually related to mental health and the criminal justice system. According to our partners at the Florida Health Justice Project, as a result of the inadequate access to appropriate mental health care, Floridians with severe mental illness are at an increased risk of kind of becoming entangled in the criminal justice system. On any given day, for example, nearly 1/5 of the inmates in the Miami-Dade County Jail, so approximately 1,200 individuals, are people with mental illness and in need of psychiatric medication. In Broward and Palm Beach counties, that rate is at 25%. Now, this bill from Representative Federhoff and Senator Wright actually looks to put in place a 3-year pilot program in 4 different counties, Flagler, St. John's, Volusia, and Volusia, right, so 3. Now, the sheriffs in those counties would use the funds from this bill to create behavioral health intervention units that are made up of deputies who would be specially trained to identify and assist individuals having mental health episodes. Now, this would be in place of referring people to prison, which I think is what we're all trying to get to, is providing people access to care as opposed to, kind of treating mental health issues in our prison system. The training for deputies would be developed by mental health experts. And I think this, program like this might be great learnings if we're able to do it right and to then apply some of those learnings to things happening, to other parts of the state. Now, I wanted to end our last kind of category of bills just looks at kind of, I don't want to call it miscellaneous, but it looks at consumer protections, initiatives to increase access for consumers, and health equity. Just as I mentioned it before, but just to highlight it again, last fall, we were really lucky to have the opportunity to work with Joseph Benton from the Rural Health Partnership and Jeff Feller, everyone knows Jeff, from Well Counsel, on a rural health focused virtual event. I say lucky because I ended up learning quite a bit from both of them about some of the biggest needs in rural communities. Whereas we wanted to talk, I think, a little bit about the impacts post-COVID, they really did a great job of lifting up conditions that have existed long before that and, persist and maybe were exacerbated by that. One of the biggest things I walked away from that meeting with was the need for better internet service in some parts of the state. I think, in other places, it's really easy to take for granted how accessible the internet is and how well the infrastructure is set up for that, forgetting that that's not an equal experience across the state. But in a world where, kids are doing virtual school and everything is based online, access to high-speed internet is becoming a more critical part of life. Senator Osley and Representative Chuck Clemens' bill would take steps to address that infrastructure for internet services throughout Florida. Now, while the bill doesn't mean, if the bill was passed, it doesn't mean that everyone would automatically have internet and that they would just start rolling out this massive infrastructure project. It at least starts to get at some of the information that we might need to create better networks. The Florida Office of Broadband within the Department of Economic Opportunity would be tasked with developing GIS maps showing where Florida's underserved communities are. And this bill also creates a task force that's responsible for creating a game plan to deploy broadband service across the state. I also found it interesting that this bill creates a definition for what constitutes an underserved community when it comes to internet. But I don't think we need to get into technical definitions of megabits. Now, like I mentioned, it should come as no surprise that telehealth is getting a lot of attention this legislative session. There are more than a couple of bills filed, but Senate Bill 700 has actually been moving through the process in the Senate. The most controversial part of this bill is that it allows out-of-state providers to provide services in state through approved non-physician healthcare providers. Additionally, it allows providers to prescribe controlled substances through telemedicine. And as you can imagine, that's another point of contention. A feature of this bill, though, that we've seen in some of the others that have been filed is that it seeks to open up the definition of telehealth to include audio-only devices, so, telephone calls. But unlike the other telehealth bills, like I mentioned, this one has some early momentum. It was adopted by the Senate Health Policy Committee as a bill and passed unanimously last week. It now goes to the Appropriations Subcommittee on Health and Human Services. And now a quick look at two additional telehealth bills. The first is House Bill 247 and Senate Bill 660, which echoes some of the proposals that we saw in Senator Rodriguez's bill, including expanding the definition of telehealth to include audio-only telephone calls and allowing providers to prescribe controlled substances through telemedicine. The second bill from Senator Osley, I think, does a couple of important things. First, as we go all in on telehealth, Senate Bill 1250, I think, looks to put some limits on that by prohibiting Medicaid specifically from using providers who rely solely on telehealth to achieve network adequacy. We know that if you have a network that's just made up of telehealth providers, that leaves a fair amount of people out. And it also just assumes that everyone has both the ability to access care through telehealth or that's their preference. But it also prevents health insurance plans from denying payment for covered services through telehealth. So it stops them from saying, well, hey, although we provide this service, we only allow for it to be provided a certain way. And then finally, it prevents HMOs from requiring enrollees to receive certain benefits through telehealth. So health plans wouldn't be able to say, hey, you can only get services this way. Now, as I considered bills that might be of particular interest to rural communities, this one stood out at me. Over the years, I've had the pleasure of engaging different regional planning councils on a range of different issues. And considering how big the state is, they really do help to create regionally appropriate solutions to issues as they come up. This bill by Senator Bradley, who actually represents some of Florida's most rural counties, looks to significantly limit the advisory role of RPCs. It does allow local governments to make recommendations instead, but I think eliminates some of the cross-county cooperation that we see through the planning council. So just something to put on our radars, and certainly something that we're watching. Next, this bill from Senator Rouson and Representative Brown, tries to address the disparities that our experience with COVID exposed more broadly. Across the country, the COVID-19 pandemic exposed a lack of equity in healthcare. And I think that's obvious. 1 in every 1,000 Black Americans died of COVID-19 in 2020. We saw that Black Americans were 1.4 times more likely to be infected with COVID and 2.8 times more likely to die. And non-Hispanic Black Americans are also 5 times more likely to suffer infant mortality than white Americans. So this bill tries to make counties more intentional about health equity by establishing a minority health liaison in every county. That liaison would be responsible for making sure counties are implementing existing health equity policies. And the bill also tries to guide cooperation between those liaisons and the Florida Office of Minority Health and Health Equity. Finally, it requires the Office of Minority Health to release reports and identify areas in need of improvement. Now, last on our bills to look at are these two related to consumer protections. Unfortunately, too many of us have personal experiences with cancer overall, but specifically breast cancer. Senator Berman's bill tries to relieve some of the burden in those difficult moments by limiting what cost sharing requirements health plans can apply for certain breast cancer tests and procedures. Now, House Bill 1111, filed by Senator Broder, looks to protect consumers by limiting the discretion of insurers in deciding what financial assistance to count towards an enrollee's deductibles. Now, this is a common issue for, I think, consumers who end up paying for prescription drugs in particular with like pharmacy benefit cards. A lot of times that isn't added to the, a person's yearly deductible or out-of-pocket costs. And in some ways, insurers get to double dip. So that's a bill that we're watching with great interest. Now, I just wanted to push ahead with a couple of ways to engage. And I see that there are a couple of questions or movement in the chat. So happy to circle back to that. But just quickly, different ways to engage with the work that we're doing on the ground. That was a lot. The bills were a lot. And certainly we've only scratched the surface of what to expect during legislative session. We know, I should mention before we move on from there, that so much of what happens with healthcare during session is really in the budget process. So while I didn't touch on much of that, my hope is that when we do a debrief in a few weeks, that maybe we can have the Florida Policy Institute join us because they do a lot of budget focused work. But I'll make sure to have that perspective and kind of a debrief on what's happened there included in the presentation. But in the meantime, I hope that you'll all consider getting involved and partnering with Florida Voices for Health. Now, you can get plugged in with Florida Voices by visiting us online at healthyfla.org. You can also send me an email at scott@healthyfla.org. We try to keep, we do keep an email list of advocates where we send weekly updates on legislative session, especially over the next few months. And then once we're outside of session, just overall policy updates, things happening on the federal level, and kind of anything we see moving on the state and local levels. We also try to lift up the priorities of our partners and make that information available to everyone.
Did we lose Scott?
Looks like it.
Let me see if I can get through to him. Hold on, I'm doing a text. I think he's coming back on. If you want to just hold tight, we're about ready to get into questions. Give him a call too. Just hold on a sec. Guys, his internet went down. I think the IT companies who are heard him talk about the broadband mandate probably got to him. So just give him about 30 seconds. He'll be right back on. And then we'll get into some Q&A. Just hold tight. I appreciate your patience. I'm sure this isn't the first time in the last year you guys have been through something like this with the Zoom. Don't see him yet. Let me try another quick call.
Hey guys, sorry about that.
Thank you. You're back. So you're on again. You going to share your screen or got a little bit?
So I'm on my phone right now, so might not be able to share. I don't think I'll be able to share the screen until my internet comes back up. So,
well, let's try to summarize as best as possible. Especially let them know about the Google Doc that that's gonna be live and whatever else you have, and then we'll get to some questions.
Sounds good. So yes, we have like I mentioned, as part of joining the Florida Voices for Health Coalition, we share a legislative tracker each week where we update on bills that are moving, all of the bills that we're tracking. Most everything we covered today is already in there, and I'll be updating that at the end of the week. And then we send out an email update at the end of every week because I know it's hard to go back to the tracker to see what's changed. So we just highlight any kind of movement that's happened, some of the committee meetings and things like that. So for folks who are looking to be a little more plugged in that way, we have that resource available for you. Now, if you are looking, or if you're interested in being engaged on in the work for Medicaid expansion, that's actually our largest campaign push right now. Florida Voices for Health, we're very fortunate to be a part of Healthcare for Florida, which is a coalition made up of our great partners from across the state. There are many ways to get involved, including directly joining the coalition. By joining, you'll be invited to specific coalition meetings and brought on as a strategic thought partner. Now, you can always share these calls to action without being official part of the coalition. You can help us get the word out by sharing our different calls to actions with your networks, especially as we try to highlight the importance of Medicaid expansion in rural communities. There's also an opportunity to advance oral health. Sorry, I think I'm dangerously close to getting back on and being able to share my screen. But for those with an interest in oral health, we would love to also bring you into that work. Florida Voices for Health and some of our in-state partners like Catalyst Miami, we're part of a state-based coalition called Open Florida. Open, which stands for the Oral Health Progress and Equity Network, is actually a national coalition initially launched by the DentaQuest Foundation a few years ago. The coalition grew and eventually formed as a standalone organization. And now we have Open Florida, which is not an official subsidiary, but really how we organize, how the members of that national organization organize here in the state. And we're working to advance the adult dental benefit in Florida. We're fortunate to be working really closely with some of the bill sponsors. So if that's work you're interested in, it's a really good chance to engage with some of our elected officials. Now, I'll say that a significant need in this space is access to more stories, especially the stories of Floridians who are currently enrolled in Medicaid and have come up against the extremely limited dental benefit, which we talked about. So the more we're able to highlight those experiences, I think we can set up this piece of legislation for success, maybe not this legislative session, but a year or two, maybe more down the line. But finally, for those who are interested still in the oral health space, if you're interested in joining the push to bring dental therapists to Florida, our partners at Floridians for Dental Access have been leading that charge for a few years. Now you can learn more about that work at floridiansfordentalaccess.com, but I think they feel really good about the positioning of the bill this year as it's something that they've been working on for some time. I'll stop there, see if I can't get myself back on here, but yeah, we'll take any questions you have.
Scott, before you get going and before questions, let me just, as you know, many of us have some limitations as organizations in terms of the advocacy, but clearly today, like getting the education and even if we aren't on the forefront of doing the advocacy work, I do believe there's a big space in there to keep informed for our constituents with what you guys are doing. And then help, if we need to help inform other, constituencies as well. Some of us might be able to be a part of information sharing rather than, outright advocacy, of course.
And that's a great point. And I think we fully expect that anytime we're in spaces like this. For us, as big of value, like almost bigger value than participating in advocacy is helping to share information. And I think part of that, there are two levels to that. One is just, kind of sharing how policy is being implemented and what that looks like. But I think more on a qualitative side is looking at the stories and personal experiences of people in rural communities and how some of the barriers that exist there are playing out. And that's across any one of these issues: oral health, mental health, physical, health, anything.
And really quick, because I want to let people get questions. You and I have been playing ping pong with this presentation, and I just want to make sure you send me the PowerPoints. We've had quite a few requests for I want to make sure I have the most recent version. I probably do, but just in case, if you email it again to me today. And secondly, you did share a link that we shared with folks that basically was an active Google Doc that updated people on the legislative information. So even if they don't sign up for any of these efforts, they can always go to the Google Doc. Now, they won't get the context of being part of any, the regular emails, but they can constantly access using that link, the Google Doc that you will update weekly, correct?
Absolutely. And Jeff, I think you might be on that larger coalition list.
Yes,
so as you get the emails each week with kind of the high level like changes to the tracker, feel free to share that with the folks. Yeah.
Okay. Now I apologize to everyone. Does anyone have questions directly to Scott? I'm gonna have to see if anyone's raising their hand or doing anything, or if there was anything in chat. Most of the questions I've gotten, Scott, were that they wanted your background materials and things, and the taping of today's, so they could re-record it, rewatch it, that kind of thing. Any questions?
I don't have as much of a question as I have a just kind of a talking point. This is Kyle.
Kyle, you're from Dixie Gilchrist Levy, right?
Yes, sir. Yes, sir. I've been, because rural internet is pretty high on our list because it does kind of hinder a lot of our stuff over here in the we're kind of on the west side of Florida here, on the west coast of Florida, should I say, up on the north central side. And one thing that has been coming out more and more is I don't know if y'all heard of it. It's called like Starlink. It is a it is internet, and it is through satellite, but it's supposed to have a lot better than like a HughesNet, anything like that. That gets kind of a bad rap. And that's actually going to be available in Florida starting, I think it's supposed to be mid to late 2021. And it's through satellite, so it doesn't take all those wires and all that stuff, can be done up quicker. Now there is a upfront cost like $500 to set it up apparently, but up north where they're kind of testing it out right now has some really good for businesses and also for residents and stuff, that they've had very promising results. So that might be something that can help a lot of the connectivity in a lot of our rural parts around here. So
that's a good point, Kyle. This is Jeff. I've listened to a policy show last week, and there is a federal effort afoot to, for lack of a better term, put more of a satellite net up there to try to expand broadband, because they're thinking it might be easier with more satellites crowding the heavens than running cable and running fiber optics.
Yeah.
Because right now the biggest problem with the satellite is there's not enough satellites up there to give it the kind of coverage you really want in many areas. But
exactly, that's why it's going to take it probably till the end of this year for it to be, or mid to late in this year before Florida really sees it take off here, because like you said, they need the density of satellites to make it function like it needs to.
So say a prayer for Elon Musk.
Yeah.
Any other questions or comments? Well, Scott, we've got a lot of favorable comments in the chat, and again, just wanting more information, I'm going to sort of remarket the taping of this and then send out the PowerPoint to everyone and remind everyone of the link to the Google Doc so they can keep tabs on all the work that you guys are doing to keep everyone informed on the bills that you mentioned today. So without any further ado or any further questions, we'll end our presentation for today. And I really thank everyone's participation, and we will be pushing this information back out to you so you can monitor things as the legislative session begins in earnest.
Really was my pleasure, guys. Thanks for bearing with me on that internet breakdown there, but absolute pleasure.
I told everybody that's because you were cursing the internet providers.
No, yeah, and I'm in Gainesville, so they heard.
They heard, you got it. All right, guys. Thank you, everyone. Thank you. Thank you so much.